Hello everybody, today we will try to learn about mandibular nerve. Mandibular nerve is a terminal branch of trigeminal nerve along with maxillary and ophthalmic division. It has a sensory role in the head and is associated with parasympathetic fibers of other cranial nerves. However, unlike the other branches of trigeminal nerve, the mandibular nerve also has a important motor function. In this video, we shall look into the anatomy of mandibular nerve and its anatomical branches, sensory, motor and autonomic functions. So let us first consider the anatomical course. The mandibular nerve contains both sensory and motor axons arising from three sensory nuclei: mesencephalic, primary sensory and spinal nuclei of trigeminal nerve, and one motor nucleus, which is also known as motor nucleus of trigeminal nerve, respectively. The motor route runs along the floor of trigeminal cave beneath the ganglion, joining the sensory nerve before leaving the cranium through the foramen oval. Now let us understand the sensory functions of mandibular nerve. The sensory fibers associated with the mandibular branch of fifth cranial nerve provide innervation to the facial skin in the lower third of the face, including chin and the lower lip, the inferior row of teeth and gingiva, the anterior two-thirds of the tongue. Mandibular nerve, after exiting from the foramen oval, gets divided anatomically into three parts: the main trunk, anterior division and posterior division. Let us start to learn the main trunk. The main trunk divides into many nerves: nerve to medial pterygoid, which supplies to pterygoid muscle; nerve to tensor villi palatini; and nerve to tensor tympani muscles. Tensor tympani is muscle of middle ear and tensor villi palatini is muscle of soft palate. Now let us try to understand about anterior division of mandibular nerve. This is basically motor in nature. It supplies temporal branch to muscle temporalis, masseteric branch to muscle masseter, and buccal branch, which is sensory in nature, to the buccal mucosa of the cheek. Now let us try to understand the posterior division of mandibular nerve. The posterior division is larger than the anterior division. The nerves of posterior division are lingual nerve, which is sensory in nature and supplies to the anterior two-thirds of the tongue, predominantly mucous membrane. Inferior alveolar nerve. It is the branch of the posterior division which supplies to the teeth and the mucoperiosteum of the mandibular teeth. Mylohyoid nerve, which is the branch of inferior alveolar nerve, which is motor in nature and supplies to the mylohyoid muscle. Digastric, which supplies to the anterior belly of digastric. The ultimate branch of the inferior alveolar nerve is mental nerve, which basically supplies to skin of chin and lips as sensory nerve. Last but not the least, mandibular nerve also gives a branch known as auriculotemporal branch, which supplies to the skin of scalp, particularly auricular and temporal region, and is sensory in nature. Let's discuss in detail about auriculotemporal nerve, course and function. The mandibular branch has emerged from the cranium. It courses through the infratemporal fossa, branching into four tributaries, which are described as: first, auriculotemporal nerve. The auriculotemporal branch arises from the trigeminal nerve as two roots: superior root, which comprises the sensory fibers; inferior root, which carries the secretomotor parasympathetic fibers, originating from cranial nerve number 9 to the parotid gland. The two roots converge in proximity to the middle meningeal artery. After converging, the secretory motor fibers run to the synapse and gets joined to otic ganglion, while the sensory fiber passes through the ganglion without synapsing to eventually innervate anterior root of auricle, lateral part of temple, anterior external meatus, anterior tympanic membrane. Let us discuss in detail about buccal nerve, course and function. Now I will talk about buccal nerve. The buccal branch of mandibular nerve contains sensory fibers. As it emerges from the mandibular nerve, it passes between the two heads of lateral pterygoid muscle before heading to its target sites. The nerve provides sensory general innervation to buccal membranes of the mouth, that is, our cheeks. It also branches to supply the second, third molar, which is important when performing dental work on those structures. Let's discuss in detail about inferior alveolar nerve, course and function. Now we will talk about the part inferior alveolar nerve of mandibular nerve. The inferior alveolar nerve carries both sensory and motor axons to and from the respective trigeminal nuclei. After branching from its parent nerve, it gives rise to mylohyoid nerve, which is a motor nerve to mylohyoid and anterior digastric muscles. The remaining sensory axons enter the mandibular canal, a narrow tunnel running through the mandibular bone. With its canal, the nerve provides branches to mandibular teeth. The nerve emerges through the mental foramen as the mental nerve. This mental nerve provides sensory innervation to lower lip and the chin. Let us discuss in detail about lingual nerve, course and function. The part known as lingual nerve. This branch of trigeminal nerve carries general sensory axons. It also acts as conduit for spatial sensory and autonomic fibers belonging to cauda tympani, a branch of facial nerve, which is seventh cranial nerve. General sensory fibers innervate the anterior two-thirds of the tongue as well as the mucous membrane lining its undersides. The spatial sensory fibers carry on with lingual nerve to provide taste to the anterior two-thirds of the tongue. The autonomic fibers branch to synapse the submandibular ganglion, which eventually innervates the submandibular and sublingual glands.